Siobhain Mcdonagh.
Thank you, Mr Deputy Speaker. And given that this is my first contribution to in the House in the new Parliament, may I say that it's a pleasure to see you in the chair. Given the title of today's debate, I'd like to start by expressing my sincere admiration for the selfless and dedicated staff who've kept our NHS operating this winter under the most testing of circumstances, a period that has pushed A&E waiting times to their worst on record. But despite 10 years of austerity leaving our treasured NHS desperately short of staff, services and supplies, the biggest threat to my constituents is found far closer to home, because, Mr Deputy Speaker, it's back. From now until April Fool's Day of all days, my constituents are once again being consulted on the future of St Helier Hospital. Under countless brands and titles, this consultation has been run time and time again at a staggering cost of over £50 million. This latest consultation has been triggered thanks to the government pledge of £500 million to Epsom and St Helier NHS Trust. This time it's branded Improving Healthcare Together, building upon the unscrupulous foundation of its predecessors to determine how these funds will be used and where acute hospitals should be based in South West London, in Epsom, St Helier or Belmont. Now, of course, I welcome any investment in our treasured NHS, but as ever, the devil is in the detail. These latest proposals push for both St Helier and Epsom hospitals to lose their key acute services, moving them south to Belmont. This is the reality. St Helier would lose its major A&E, consultant-led maternity, acute medicine, critical care, emergency surgery, inpatient paediatric and children's beds. Mr Deputy Speaker, that's a 62% of St Helier beds, leaving a shell of a hospital more accurately described as a walk-in centre. The consultation assumes that my constituents will travel to the new site regardless of where it is, but they won't. If St Helier is downgraded, my constituents will turn to either St George's, where the A&E is already in the bottom quartile for space standards, or Croydon University, where bed occupancy is already at 99%. How can it possibly be a sensible idea to force even more people to rely on such overstretched services? The impact would be devastating. Mr Deputy Speaker, I've pointed this out time and time again to those running the consultation. Meanwhile, they've spent millions of pounds of taxpayers' money on misleading impact reports, which utterly astounding gaps in their analysis. Take Pollard's Hill in my constituency, an area that would be considered deprived in comparison with much of Sutton or Epsom, but an area deemed by the consultation to be outside of St Helier Hospital's catchment area. And yet the largest GP surgery in Pollard's Hill directs 34% of its patients to the hospital. Why does this matter? Because if areas that rely on St Helier are not even considered in the analysis, how can the potential impact of moving acute services from the hospital be adequately assessed? But when I point these gaps out, they simply fail to be rectified. Instead, they disguise the health and deprivation figures in my constituency by including the neighbouring constituency of Wimbledon and calculating the deprivation for Merton as a borough. But this is not a political tool, this is a hospital, and it should be based where it is needed most. And it gets even more unbelievable, because this deficient evidence was then assessed in behind closed-door workshops, with all those attending forced to sign a non-disclosure agreement before being allowed in. And that brings us to present day, with the latest consultation launched last week. This flawed analysis has been used to decide upon Belmont as the preferred site for the acute services in South West London, and the preference has clearly stated on the consultation document itself. How can this possibly be acceptable? Maybe I should just be grateful that these documents were actually delivered to all households this time round, rather than to their preferred target areas like last time. It's time for some accountability and for the government to step in before the future of St Helier Hospital is thrown into jeopardy. I challenge every foundation that this programme has been built upon, and I appeal to the Minister to step in before another penny of taxpayers' money is wasted on this bogus consultation. It's time for the madness to end. Leave these vital services where they are most needed, at St Helier Hospital on its current site.